So welcome everybody to the MaxLove Project podcast. It is our brand new podcast with myself, Audra, and Samantha. We're so excited to be able to bring you all kinds of wonderful conversations with people we love and admire and learn from in the childhood cancer and rare disease space. So we're going to be having many different conversations from here on out. And our very first conversation is with Dr. Bonnie Goldstein. So first off, I'm Audra. I am the founder of MaxLove Project, and I'm Max's mom. Max is a kid who has had a high-risk, low-grade glioma brainstem tumor or set of tumors, group of tumors, whatever you want to call it, for 13 years and counting. And we used cannabis medicine along our journey often, thanks to Dr. Goldstein. Sam, I'll throw it over to you for your intro.
Yeah. Hi, I'm Sam. I'm mom to three, Camila, Lucia, and Liam. Camila's my warrior. She battled DIPG. We utilize cannabis a lot, both in trying to be proactive in, inhibiting tumor growth, and we also use it a lot along treatment to, subside the side effects from things like radiation.
Awesome. Thank you, Sam. And with us here today, we have Dr. Bonnie Goldstein, who's a licensed physician in California for the past 32 years. Dr. Goldstein trained as a pediatrician at Children's Hospital of Los Angeles, where she also served as chief resident. After her residency, she became a critical care transport physician for a few years at Children's Hospital, and then went on to practice in pediatric emergency medicine at a number of different hospitals, including LA County USC Medical Center 2008, which is pretty hardcore. You saw some probably pretty intense emergencies there. I would imagine this probably the largest level 1 trauma center in the area. After witnessing the benefits of medical cannabis in an ill friend, her curiosity was piqued, and she began reading about medical cannabis and started working in the field. So she's been a medical director of Canna Centers, which is a practice that Dr. Goldstein has in Los Angeles, where she sees patients and is also the co-founder and CEO and chief science officer of a new company called Goldstein Wellness, which is very exciting. I got a little sneak peek hearing about this, which is serving to educate healthcare practitioners about cannabis medicine. Dr. Goldstein is also the author of a book called Cannabis is Medicine. For many of us parents, it's the first step that we took in diving into this, is actually reading Dr. Goldstein's book. And in her career, she's treated thousands of children with epilepsy, severe autism, and advanced cancers, as well as many other conditions. Dr. Goldstein, welcome to the conversation. Is there anything you'd like to add to the bio?
No, one last thing I left out was just I'm doing some research using salivary biomarkers. So we collect saliva, and I worked with a company called Camphormatics, and we published 3 papers on the objective impact of medical cannabis on children with autism. Amazing. How it helps them, and we are one of the first groups to document actual objective improvements in chemical pathways due to the cannabis effects of the cannabis. And it's
incredible.
We found no patients in our group that were being treated with cannabis who actually had any worsening of any pathways. So just reassures us that what we're seeing, what the parents are reporting, correlates to actually what's happening in the chemistry. So I'm really excited about that technology and hoping to start using that.
It's incredible. Thank you so much for sharing that and for your amazing work. I know how deeply needed that is. Like when we, as parents, have that anecdotal evidence or our case studies, to see that validated in research is everything. And that's really how you start to disseminate the information and build that legitimacy. So that's incredible. Thank you. And I know in autism, it's something that's really been, I think I was with you at an event with a group of moms who have just seen such incredible effects, but they've been propelling it themselves. And so to be seen by the scientific community has got to be so big.
It is. And Listen, I give parents a lot of credit. When you have a child that's struggling with illness, I believe my parents when they tell me it
Yeah.
works, and they tell me it because I hear when it doesn't work, and it doesn't work for everybody. And cannabis is different than pharmaceuticals in that you have to trial and error it. It is customized medicine. It is not one size fits all. It's not cookie cutter. It's not like, oh, you have this disease, you take this dose. That's just not the way it works. And we
Right.
have to recognize that. That was something I had to wrap my brain around when I first came to this, because remember, I worked for 15 years in the allopathic model, which I love,
Yep.
by the way, but
Yep.
we have to look at this differently. And I think having some objective data is just going to help the medical community overcome that propaganda and all of that stigma that still exists with cannabis medicine.
I think it's amazing, Dr. Goldstein, and that you worked in allopathic medicine as a strength, and that you appreciate that background. You see the uses and benefits. I think is such a strength, because we need people who are able to speak that language and build the bridges. It's just such an important role that you play. So you started Canna Centers, and you've been in practice now and serving thousands of patients. What is your practice like? What is the process been like for you starting Canna Centers and starting to directly serve patients with cannabis medicine?
Sure. So when I first started, I was actually working for a doctor who had started a company with a different name. And I came in, and he was doing some other things as well. And he said, I need a medical director, so I'm going to put you in there and let you, do it. And I'm a science geek, and I'm a neurotic, doctor. So, which serves me well in my professional life, maybe not so much in my personal life, but I started reading articles. I learned, I trained very well at Children's Hospital. One of the first things I learned, I had good mentors there, and they taught me, listen to the parents. The parents will help you. When a child can't tell you what's wrong, you have to listen to the parents, and then you examine the child and you try to put it together. It's puzzle pieces.
Yeah.
And I always felt like I was good at that. I'm not good at very many things, but I was a good clinician, and that's why emergency medicine and I kind of went together. I enjoyed that, being able to make a diagnosis and help a child get well and reassure the families. And it's kind of the same thing in my practice. When people come in, I spend an hour with them at least. Sometimes we go over because there's a lot of detail I'm catching up on. I don't diagnose patients. What I do is I ask people to send me their medical records so that I can see why are they struggling? Why are they coming to cannabis medicine? Can cannabis medicine help them? And sometimes we do turn people away because, one, there's a drug interaction, or two, cannabis hasn't been shown to be appropriate. Not very often, but because cannabis can treat so many different things. And I think this practice has really, opened my mind. Look, when I was at Children's, I saw lots of very sick kids. It made me very comfortable with every diagnosis under the sun, especially critical care transport and then ER. You just get comfortable with sick children. And I think that has served me well in that nobody is coming to me with just a little owie, right?
Right.
Coming to me, if you're
Right.
in my office asking about cannabis medicine,
Yeah.
it's because your child is struggling and you have not found the answer. 90% of the people that come to me have already exhausted what allopathic medicine has to offer for the most part.
Yeah.
Yeah, I
Thank
think
you.
that's really important, what you brought up about being comfortable with kids. Because I think as parents, even on this journey, we're constantly told, nope, even if they're an expert saying cannabis or anything else we're considering, it's mostly pushed away. Like, you have a child, they're 5 years old, like they don't feel comfortable in that space. So I think it's really like I'm feeling ease in you even saying that, like that you feel comfortable with kids. And I think it's really important, especially in this space.
Yeah, absolutely. The rapport, in the sense that I know I felt this way sitting in your office, is that kids,
Mm-hmm.
the medical condition, the drugs. This goes back to your experience in standard of care medicine. What makes me more nervous is working with somebody who's only worked with adults in, let's say, alternative medicine and knows nothing about what my child is going through with standard of care. So you being able to bridge that gap, being comfortable with kids, validating, supporting, seeing the parents, understanding what we're going through, and being able to show up and support us in a variety of ways. Like it's gold, and it's rare. We rarely have that experience.
Luckily, there's more pediatricians interested in this, because when you're a pediatrician and you became a pediatrician for a reason, right? You didn't go be a surgeon or an eye doctor. You're a pediatrician. There's something that you have a connection with children. And if you're watching a child suffer, and remember, when a child suffers, the whole family suffers, as you guys know all too well, right? It's not just a person going through a problem. It is the whole family. And if a pediatrician sees that, I do think that they kind of get, well, maybe we should try cannabis. Maybe I'm not comfortable with it, but there's somebody else out there that is, and maybe I can learn about it. Because I am getting more contacted more by other pediatricians who ask, well, I want to learn what you're doing. I want to understand. And remember too, now we don't have just THC. We have a whole arsenal of non-impairing, non-intoxicating cannabinoids, CBD, CBG, CBDA. I mean, my husband calls them the ABCs. So a lot of letters, but I incorporate THC. THC is needed. It is just a tool in the toolbox. All of the data stating that THC is, quote, bad, and I'm putting quotes around that, for the developing brain, come from studies looking at teenagers and young adults who are self-medicating / recreating / problematic use.
Right.
And I have to say, that is not medical cannabis. They are not equal. Medical cannabis is supervised, dosed, products are selected specifically for what is in them. It is not random, bong hits. Okay. So let's make sure we understand there is a difference. I find medical community does not want to acknowledge that difference, but they acknowledge it with opioids. They'll write a prescription for opioids, but they don't equate their patients to a heroin addict. And look, addiction is addiction. It's a problem. And I'm not saying we shouldn't address the problem with young people who have problematic use of cannabis. Let's address it, but that is not what I'm doing in my office. And I will share with you that I don't get to say 100% very often, but 100% of my patients who take THC are taking it because it's helping them. And if it turns out that it gave them anxiety or it wasn't helping them, we don't leave them on it. We change it. Right.
Like you would for any medication.
Exactly.
Yeah. I think that's such a powerful point, and I'm so glad that you made that. We have to look at symmetrical comparisons, and I think you're right. It's totally out of turn to compare the two, recreational teenage use to supervised medical use. I think it's a really, really important point to make. I'm glad that you shared that. Steering back to the benefits of utilizing cannabis medicine for childhood cancer and rare disease patients, what can you share some of the benefits that you've seen? And then also, we'd love to know if they vary by diagnosis. Both Sam and I are brain tumor parents who, for me, I was brought into looking at cannabis for neuroprotective effects, and quality of life. I don't know much about leukemias and other cancers. We'd love to hear about benefits and how it might vary by diagnosis.
So there's a lot there. So let me unpack it a little bit.
Sure.
So in terms of benefits, let's just say for a child who's struggling with a cancer diagnosis, it can be as simple as a tiny bit of THC or CBD or CBG or whichever one, right? Based on the child's response and with, the discussion with the doctor. But a low dose cannabinoid can help with symptoms of cancer. So if you have pain, headache, poor appetite, you're not sleeping well, the trauma of being a patient, that all that anxiety and some of that depression that sets in, that we witness, they're out of control. Our children don't have any control when they're thrown in a bed and they poked left and right. Cannabis can help with all of that. There's clear-cut evidence that it can help with, and the top three things that we see in adults is pain, anxiety, and sleep.
Mhm,
Same thing with
mhm,
children, okay?
mhm.
You don't need a lot of cannabis to get those benefits. Then the next thing we see is helpful benefits for side effects of cancer treatment. So as we know, chemotherapy can make you feel like poop, and it just, I've had parents say, my child's eating better. They're playing. They're getting up out of bed in the morning and having a full day and playing. As simple as that, rather than laying in bed, feeling lousy, having no energy. And, you have to remember there's different kinds of cannabis and they have different effects on energy level. A lot of people think, oh, somebody smokes a joint and becomes like a couch potato. Yes, that can happen, but that is not all cannabis.
Right.
Okay. And then we have the actual direct effects that I have seen in some patients of the cancer killing effects of cannabinoids. And so I want to make it very clear, there is a huge body of knowledge in what we call the preclinical scientific literature in animals and test tubes that cannabinoid compounds, THC, CBD, CBG, and others, can kill cancer. And so how does that happen? So the effect of cannabinoids, and that's part of what I put in the course that the MaxLove Project has to offer, is how this happens. And it's basically very similar to chemo. These cannabinoids affect certain chemical pathways and change, shut off, turn on different pathways. That's how it works. And so what we know about cannabinoids in cancer is, one, that when a cannabinoid like THC binds to a cannabinoid receptor, which is on our healthy cells, but also exists on some of certain types of cancer cells.
Okay.
When it binds like a key in a lock to that receptor, it tells the cell to kill itself. Now, it might tell your brain cell that's sending the message of anxiety, turn down anxiety. If you take too much THC, it might tell the message, turn up anxiety, right? Because sometimes you can get anxious and paranoid. On cancer cells, it tells the cell, kill yourself. Okay, so that's number one. Two, cannabinoids through certain chemical pathways have been shown to inhibit the growth of tumors. Just tell the tumor, stop growing. Then there's also studies that show that THC and CBD both can send a message of turning off the spread of cancer, the metastasis. So it's anti-metastatic. And how does it do that? Well, cancer cells send messages to spread, and cannabinoids can block that message. And then there's also anti-angiogenic. So angiogenesis is the growth of blood vessels. Cancers like to hijack your sugar, your oxygen, all the nutrients for themselves. They build themselves their own blood vessels to grow tumors. And just like many foods, like mushrooms and strawberries have anti-angiogenic properties, so does the phytochemicals, the compounds, the cannabinoids found in cannabis. And then a few other things. There's some studies that show, and again, these are in test tubes and in animals, that cannabis plus certain chemotherapies can synergize and kill more cancer cells together, meaning the cannabis actually helps the chemo. And then we have some evidence, a handful of studies showing that cannabinoids can also enhance the effects of radiation, making cells more sensitive to the effects of radiation. The biggest problem we have with this is we do not have human trials except for a few, which I bring up in the videos that you have now. And so for GBM, glioblastoma multiforme, there is a trial out of the UK where they used a 1-to-1 ratio plus a chemotherapy. And then they compared it to other people who just did the chemotherapy alone, which were kind of the control group. And they found that the people who added cannabis had a prolonged, or it extended life. And they had a few side effects, but remember, you can also, you're on chemo too. So
Right,
it's hard
sure.
to know when you have, which side effects you have from, from which thing. But there's no question that I see extension of life in my patients. And I've even had doctors call me and say, you need to tell me what you're doing because my patient who probably should have died is still alive. And yesterday I just posted, this is so interesting. I have a friend and colleague who is an oncology veterinarian.
Oh, I
And
saw
she
that. Yeah.
just published a paper on a cat that was given a few days to weeks of life due to a big mass that the owner decided not to pursue because it would have just been a disaster. And the cat lived 6 months with a great quality of life on cannabis medicine running. And even the owner says, and Dr. Hazza puts in the paper, the cat was even doing better than the cat had ever done because the cat had some other medical issues.
Yeah,
And
yeah.
on cannabis, the cat's like running around the house and eating great and playful and happy, and it just has this quality of life. And so this is not, and again, I never say cure, because now have I had some patients who have achieved cure after they've been diagnosed with a stage 4 osteosarcoma or Wilms tumor? Yes. Can I say it's the cannabis? No. What I can say is that combination of what they were doing.
Yeah.
Mhm.
Yeah.
Right. And I have an adult in my practice she's actually moved out of state, so she's no longer my patient, but I stay in touch with her because she helps people. Helps people with their food and how to fight disease with food. And she fought melanoma, and she's 6 years in remission
Amazing.
after being told, she was going to die. And she did it all with natural treatment with cannabis added on. So there are cases.
Yeah.
What we need is clinical trials in
Mhm.
humans.
Yeah. Yeah. I think that's such a great, thank you. That whole chunk there is a beautifully, succinct, and I love it because it's going to complement the course so much. We're going to break it out and be able to add it as a complement to the content. It reminds me so much, Sam, I wonder if you were thinking this too, of our work also with the ketogenic diet. Very, very similarly, people will share that this is a curative strategy. You don't need to use treatment, on and on. But what we found is that it is a really, really powerful adjuvant strategy. And we see not only incredible quality of life, there are definitely properties and research that demonstrate, the killing of the disease, but combined with chemotherapy and radiation, you find like extensive benefits. That in all the research shows that far outweigh doing the treatment alone. We don't understand all the mechanisms yet. We're not totally there. We don't have enough human trials because there's not enough funding for it. I think with cannabis, you've got the scheduling issue. It sounds like we've got an issue of where we can even get in the US, where we can even source medicine from to utilize in research. And, there's a whole host of issues. But it reminds me very, very much of that space. Do you see it similarly, Sam?
Yeah, and what was coming to mind too, and what you were saying is, something oncologists will always talk to you about when trying to find a trial or an inhibitor or some sort of drug to help your child is the blood-brain barrier. Is something like, will it even get there? And something that was popping into my head of just like cannabis and how it is able to get there. And to me, in my brain was like, then why aren't we looking at drugs that do get there instead of like hoping they get there from these other, conventional standard of care suggestions? So that's what was popping into my brain of, utilizing something that could help right directly into the brain.
And for those people who don't know, cannabinoids are fatty compounds, so they do coexist very nicely with ketogenic.
Mm-hmm.
Okay, as long as it's not in a sugary gummy, right? So
Yeah.
the cannabis oils that come in, which is what I prefer, the tinctures or
Yeah.
oils, when they come in a bottle and you can measure them out easily with a 1 ml syringe, or and so you have accurate dosing. They coexist beautifully. A lot of children with epilepsy are on ketogenic to help control their diet, and I have found the combination of cannabinoids plus ketogenic diet to be very effective in many patients who just don't respond to other drugs.
Right.
And believe me, I just want to make it clear, people don't come to cannabis because they're cannabis enthusiasts. Some people do. It's the vast majority of people that come to cannabis are because nothing else worked. And when you find great results, it feels like a miracle. And I even write this in my book. It's not a miracle, it's science, but it feels miraculous. And that is why I created Goldstein Wellness, was because I'm trying to get doctors to learn about it, to not be so afraid of it, to understand it and to help them integrate it into their practice, even baby steps, right? And one of the first baby steps is just having this kind of conversation.
Mhm.
Yeah.
You can't have a conversation if you've been told your whole
Yeah.
medical career that cannabis is bad, it's a drug of abuse, and don't you ever use it. And that's really just not okay.
Yeah,
Yeah.
I mean, something that, when you say things that haven't worked, there's also families where that conventional treatment, they don't have anything. That's what
Right.
we were told. There's nothing that we can do to help. Everything's palliative. And even in that space, it's like you start looking for anything, right? And
Yep.
that's where some families get into cannabis as well, is like, and I think that's a great segue of just, that also in that space and realm of there's nothing you can do, you start getting sucked into, you know, portals of information and all these stories.
Rabbit holes.
Yeah. And that's something I wanted to touch on too, because,
Mhm.
in that space of diagnosis, there's that trauma response. You're searching. No parent is ever going to accept that there's nothing they can do. So that's something in my experience of, and maybe this is a good segue into like the Rick Simpson oil. Whenever people talk about that curative treatment with cannabis, I think Rick Simpson oil is like number one. And I see so many questions, specifically from Camila's diagnosis, DIPG, of Rick Simpson oil, Rick Simpson oil. And then it's kind of just like parents have no idea what they're doing. They
Right.
buy the syringe and they're just hoping that this information that they read on Facebook will help. I don't know if you
Right.
want to elaborate on what Rick
Sure.
Simpson oil is and even
Let me
why it
explain
got
it,
that
yeah.
reputation.
Well, yeah, so let me explain it. So
Mhm.
Rick Simpson was a gentleman in Canada who would cook up cannabis to a really concentrated form.
Mhm.
So the way I want you to think about it is if you had a watery soup on your stove and you cooked it and just kind of forgot about it and walked away, all that water would evaporate and become thicker and thicker and thicker and thicker.
Make a bouillon. Yeah.
There
Yeah.
you go. Well, I'm not a chef, so I don't know, but yes. I should say I'm not even a cook. So anyway, you get to this kind of very thick, gooey, tar-like substance, and it was called Rick Simpson oil because he claimed that when he gave people this cooked up, very concentrated. So when I say concentrated, what I'm talking about is the actual milligrams.
Mhm.
So instead of something being like 50 milligrams, what his oil had in a very tiny amount could carry 500 milligrams. Okay. So really thick, concentrated, high dosage oil. And he claimed to give it to, I think, 20 people, and he cured this cancer and that cancer and so on. And then there was a video, and he ended up having to leave Canada. I think they went after him, but there's this myth that if you take 1 gram a day of Rick Simpson oil, you can cure your cancer. And there's probably people who did it and it worked, but
Yeah.
it is not a one size fits all. And it's
Right.
certainly not, to me, a way to do it. It's very vague. You don't know how much you're getting. And so what ends up happening is that people get like a little 1 ml syringe and it's filled with this tar, and there's like 500 milligrams in here. And so people get it and then they squeeze out a little and they take it, and they talk about taking a half a grain of rice size. Well, how many milligrams is that? What are you doing? That's not really medicine if you don't know your milligrams. And I'd like to share a quick story about Rick Simpson
Yeah.
that helped a child, but the parents, as they were treating their child, realized, oh my gosh, this is not all the same. And medicine has to be consistent somewhat. If it's not, and cannabis has a little leeway, but you want to know what you're doing, because if something is working, you don't want to get the next batch of medicine and find out that is not the same. It's not going to work
Right.
the same way. So very quickly, there's a paper published in which I can share with you. And it was about a little girl who had a very difficult type of leukemia, like a bad chromosomal type of leukemia called Philadelphia chromosome.
Right.
And she went through a couple of years of treatment, bone marrow transplant. Everything did not work out well, and she was sent home on palliative care. And the parents said, we want to use cannabis. And remember, this is like 20 years ago. And so they were in Canada. Someone gave them a syringe of Rick Simpson oil, and they started giving it to her in teeny tiny amounts. And we know it was full of THC because she was euphoric. She had munchies. And so there was an effect. And remember, they had no clue how much they were giving her. But what's interesting is because leukemia is easily measurable, you don't need a scan to see what's going on. You can draw blood, you can see the leukemia cells in the bloodstream. The doctors started to follow, they said, we're going to follow along with blood work every few days because she had a port, so it was a little easy access. And what you'll see is these graphs where her blasts, her leukemia cells are like sky high dangerous. Then all of a sudden on day 5 of cannabis, they start to plummet.
Oh,
And they go down, they go down, they go down. And then they run out of that syringe of oil and they get a new one. Then all of a sudden her leukemia cells climb.
oh, man.
So they give her more, double the
Yeah.
dose. They increase the dose. They realize, oh, this isn't as potent. And all that means is, let's say the first one had 300 milligrams in 1 ml, and the second one maybe had 100 milligrams in 1 ml. They lowered the dose without knowing. That's why it's important to know your
Right.
medicine.
Right.
And then what ended up happening too was that they went to every 8-hour dosing. At some point, she ended up back in the hospital for some infection, and they were only giving it twice a day. And sure enough, the leukemia cells started to climb again. So what they saw was the timing mattered, the dosing mattered. Well, yes, that's what we learned from that study. And so when I hear about people saying, oh, I'm taking a gram of Rick Simpson oil, that gram is not 1,000 milligrams of cannabinoid. That is a gram weight. And you have no idea how many milligrams are in that.
Right.
So I use, quote, Rick Simpson oil. We don't call it that. We call it FECO oil,
Mhm.
FECO,
Mhm.
full extract cannabis oil. But we know the we know the percentage. So let's say it's 75%. That means 750 milligrams in a gram weight, which is a 1 ml usually. I have parents diluting it so that they can measure it. We
Mhm.
get to a high dose, which we often do, then you can sometimes use that oil in that form. But we have to understand that, you know, the same way antibiotics can come as, you know, pediatrics, right? 100 milligrams in 1 ml, 250 milligrams in 1 ml, 500, it matters.
Mhm.
It's important to understand that this is not a cure-all. And one other last thing, I've had patients get it from people who say, oh, I sell it. You can buy, you know, a 3-month supply for $5,000. It is, as far as I'm concerned, it is buyer beware, and that you need to get that. You need to ask for a sample and get it tested, work with somebody who knows what they're doing. But I have had patients getting oil. It's loaded with alcohol, loaded with acetone,
Mhm.
loaded with other solvents and pesticides. Does a child with cancer need all those other nasty chemicals? Nobody does, least of all a child already struggling. So it's very important. People can tell you their product is clean or that it's THC with CBD. And if they don't know, they're just, you know, passing that along. So you do have to be a little bit, well, a lot careful with the
Yeah.
products that you're getting.
Yeah.
Yeah. And what comes to mind in this is just a whole host of other issues and things. You know, what we need to work on is, I remember I was getting FICO for Camila. I was, you know, trying to do the math, you know, on the side, like on the little labels. And something I constantly ran into was, you know, even a dispensary, they'll change the plant that they use. They can't necessarily keep something in stock that you used the first time.
Right.
And what comes to mind is like that could be a huge loophole that we fixed government wise. If we know that all these people are taking this medicinally, that could be something that the government could help control maybe, or just help monitor, because otherwise there's nothing we
Right.
can do to make sure we're consistently getting the same thing.
And that goes to the company. You
Mhm.
have to know that the company is doing the right thing. They're not just slapping whatever in a bottle and then
Yeah.
selling it.
Yeah.
You have to know the company. And I'll say that I don't endorse companies and I don't work with them or, you know, get paid by them, but I definitely have my favorite companies.
Mhm.
Yeah.
And why? Because all these past 16 years that I've been doing this, working in the cannabis field as a neurotic doctor, before we had legalization in California, where we actually had tested medicine from licensed dispensaries, we did not have tested medicine from licensed dispensaries. We had just, you know, what we called the
Right.
Wild West. I would get products tested. I would tell a parent,
Mhm.
send it in.
Mhm.
And very nicely, some labs joined hands with me and said, we'll test it for free. It's a child. Sure, we'll
Yeah.
test it for free for you.
Yeah.
How nice, right? We all come together when we know it's the right thing. And I will say that the cannabis community is so altruistic and
Yeah.
interested in
Mhm.
helping no question, but it's always going to be people who make what they make. They don't really know what they're doing,
Right.
and they make products. And, look, they're trying to help. I always try to come from that idea that they're trying to help and they're not just trying to hand out things. But like when I had a patient who came to me, brought oil, when I smelled it, was like, oh, alcohol. It's just total alcohol. It should smell like cannabis, not alcohol.
Right.
Yeah.
And we got it tested, and unfortunately, that child was on that for a year. I was really unhappy about that.
Mhm.
Oh,
Yeah.
it's so hard. I mean, it does speak to being in a state like California, Colorado, the state where you have mandated on the white market, you're like mandated lab testing. And so when you go into a dispensary, you can, and especially a good one, you can request those lab tests and you can
Yeah.
verify. It's important. But a lot of our families are in states where it's definitely shrouded in a lot of misinformation, not really regulated because it's not legal in any way. So that brings us to but they have access to hemp products. And so can you help our listener understand some of the differences between a hemp product and a cannabis product?
Sure. So hemp is cannabis. So let's just start with that. Okay, that's the name of the plant, Cannabis sativa L.
As the umbrella.
The umbrella.
Yes.
Exactly.
Yes.
And so hemp has some different qualities, right? So hemp puts all its energy into the stalk, less into the flower. So the flower of the cannabis plant is where the cannabinoids and terpenes are really made. But hemp has a flower, and if you grow it properly, you can get a lot of cannabinoids from it. But remember, our government has put out a definition of hemp, which means that it tests less than 0.3% THC by weight. Okay.
Yeah.
And it's an arbitrary number because what I come back with is if I test my cannabis that I grew in my backyard and it comes back 0.29% THC at one lab and it comes back 0.31 at another lab, it is now in two different things. The 0.29 falls into the hemp and the 0.31 is now called cannabis, but it's low THC, so it makes no sense.
Yeah,
right?
yeah.
So cannabis is cannabis. It's all on a spectrum.
The hemp plant is just a different variation in the species?
It's a different variety, right?
Yeah.
That's exactly right. And people have gotten very good at growing hemp that's rich in CBD. And so much of the CBD that many of my families, especially with epilepsy and autism, are using, they're buying hemp versions. So they're less than 0.3% by THC, but it's high CBD, but it still has a ratio like 25% CBD to 1 part THC. Okay. And it has to meet, and by the way, remember, hemp market's unregulated. So you have to be very careful about the products you use because there's lots of them out there. And some of it is just like dirty leftover culled hemp from like China, grown industrially, bad. And remember, hemp and cannabis, they're bioaccumulators. They're plants that remediate the soil. So hemp was planted around Chernobyl where there was a nuclear accident. And it sucks up stuff. So if you have a petroleum spill, they'll plant hemp and it sucks up the soil, cleans the soil. What a great plant. But that is not the plant that you want to take for your medicine.
Right.
Okay. So I do categorize like industrial hemp different than kind of hemp meant as medicine. There is a difference. But remember, so that high CBD, low THC plants that are high in CBG are usually hemp plants, but there are cannabis growers that can breed plants. It's not GMO, it's just breeding plants higher in this and higher in that. They're, just like you can make pluots and cross species. But they do a lot of, we have to do a lot of testing. The plant preferentially wants to make THC. I mean, it's one of the more dominant genes. And back in the day, so about, we understand from like 200 years ago that natural cannabis that just occurred in nature was probably 1-to-1 ratio THC and CBD. And then what happened was people bred up the THC because they
THC, yeah.
wanted that for their
Right.
uses, for their recreational use, their
Right.
rituals, their rites,
Right.
whatever. And when you breed up THC, you automatically bring down THC because they both come from the same precursor. So if it's all going in this direction, none of it's going in this direction, you're going to have more THC. So over the last,
THC pushes down
Right.
CBD. Yeah.
Yep. Yep. So what you end up having, so you can have a 1-to-1
Mhm.
and you can have very high THC and very low CBD, and you can have kind of every variation. But remember, over the last 80 years, the people that were growing cannabis for use for recreational use or even medical use that were breeding because nobody knew about CBD.
Yeah.
It hadn't been studied, right? It's really only on our radar realistically since about 2010, even though there's a lot of reports going back into the 80s on its use for epilepsy and other things. In mainstream, we really didn't hear about it until, like, I would say the first time I heard about it was probably 2011, 2012, 2013, when that, and then 2013 was kind of the explosion of,
Right.
CBD for children with epilepsy. So really the difference is how much THC. There's a lot of other differences too, though, how many cannabinoids are in there, the terpene profile and all of that. I use both. They're all
Yeah.
on the same thing. Now, remember, you can travel with hemp. So I have patients who have never been able to leave their house to go on vacation because they have 40 seizures a day. And now they only have 1 seizure a month and they want to go to Disney World in Florida. It's easier to take hemp with you. You're not supposed to cross state lines with your anything that has THC in it because of that Schedule 1 status. But I use it all. To me, the more critical thing rather than their name is really what's in the bottle and is it clean?
Yeah. I think that's so helpful because I think, we have these very old understandings, this sort of like, just from social media and kind of, word of mouth, really. So having that clarification is important. And some people are in states like the state I'm in Georgia, where I have a dispensary a block away here that I didn't mean to give that a thumbs up, that it was pointing. A dispensary down the street here that sells quote unquote hemp products and sells high THC hemp products. Now, I don't recommend that any of the families in my area here in Georgia
Can I
go
make
to
a
that
statement?
dispensary. Yeah, please.
Can I make a statement about that? So now we
Yep.
have a problem in the United States. After the 2018 Farm Bill was passed, a lot of farmers decided to switch over to grow or add CBD grow or hemp grow to their farm. And we ended up with this glut of CBD. And back in the 1940s and 1960s, so around there, scientists figured out that you can take CBD and put it through a process called acid catalysis and convert it to delta 8 THC and delta 9 THC. Delta 9 THC is the dominant compound in cannabis. Delta 8 THC is a minor cannabinoid, less than 1% in a natural plant, but it's there. Where does it come from? THC, what's called isomerizes. So it just changes little 1 double bond and becomes delta 8, just another compound.
Right.
Delta 8 has been shown in studies to help with nausea, vomiting. It's a less potent cousin of delta 9 THC. But what's happening is that people figured out we have all this CBD, we don't know what to do with it, and the price dropped, and oh my gosh, what am I gonna do with it? So people are converting, and when I say people, I mean literally not a lab, not a chemist, but people are converting CBD to delta 8, delta 9, trying to take advantage of the hemp bill, right, the farm bill, and sell it as a non-cannabis product. However, this is the problem. Delta 8 is safe and tested. In fact, Dr. Meshulam, the Israeli researcher who we consider the father of medical cannabis, who's published a bazillion studies and has been just what a prolific man and what a wonderful life's work. We just lost him last year. He made delta 8 in his lab, but it was 99% pure. And he gave it to children getting very highly emetic chemotherapy, and it worked great. They had no side effects. It stopped their vomiting. 100% of vomiting stopped. Think about that. 100%.
Incredible.
Okay. That is not what's on the market today because people who are making these products also get what we call unwanted contaminant byproducts when they are doing this conversion. They're not in a lab where they're, you know, and what's happening is the products on the market are contaminated with synthetic cannabinoids, heavy metals, other contaminations. And now we have about, I don't know, I want to say 20 to 25 people who have been written up as case reports in the scientific literature as having severe psychiatric issues from Delta 8 products, mostly vaping. And it's not the Delta 8, please understand, it's don't blame Delta 8. It's the
Thank
byproduct
you.
of the dirty contaminants that are in there. Synthetic cannabinoids have existed for a long time. They're called K2, spice. There's other names they go by. What they do is they bind to the cannabinoid receptor 100 times more potent than THC. So they can really freak you out. They can give you psychiatric side effects. They can also affect your kidneys and some other organs. You have to be very careful of synthetic cannabinoids. Why would anybody use it? Well, because then you don't test positive for THC.
Right.
Okay. So it's very important to understand that these are not safe products, and people can rant and rave. Yes, it is safe. We tested it. What if you don't even know what to test it for? That's what
Right.
I'm coming across. They don't even know what to test it for because they're developing new compounds in this process that we don't even have the test for.
Yeah.
It's so important. And this is what I was going to ask you. Being here, coming from California and coming to Georgia, to a state that barely has a medicinal program, right? This is what families encounter, are these dispensaries offering these products of dubious origin. We don't know what it is. And so you explicated that beautifully. It's really, really important, because I think a vast majority of our families are facing this type of access. And so we have, and I know that we have it in the course, we have sourcing in the course that we're offering in MaxLove Project Connect from you. This is going to be really helpful to families. There are trusted sources for products that are, I'm going to put air quote, hemp products, but we have high CBD products that are very efficacious, and some that you use widely in your practice that are available to all families. And along with that, it sounds like we have really made headway since the day that I started this with Max on understanding the properties of various cannabinoids. And so when you find a product that is primarily a product like a CBG product, how is that made? Like, what is that, more isolated compound?
Right. So CBG stands for cannabigerol. It was considered a minor cannabinoid, but it's kind of moved into the majors. It is now like THC, CBD, and CBG. CBG is really understudied. We have a lot of studies showing that it in animals, right, what it does. And it can, we know where it works. So it doesn't bind tightly to the cannabinoid receptor, so that's why you don't feel high from it, but it binds to serotonin receptors. It binds to what's called the alpha-2 adrenergic receptor. So we understand some of the receptors that it binds to, and if you know what that receptor does, then you can understand the action of the CBG. And let's say it blocks a certain receptor, then you know what that action is. So if we understand that's receptor medicine. So, and that's how, by the way, pharmaceuticals are made. They look at receptors and they develop a medicine to bind to it. Like they make the key for the lock, right?
Right.
Mother Nature gives us all of these plant compounds that interact with those receptors and other things in our body. So, but CBG is really interesting. Most of the CBG that's on the market is coming from the hemp market. I have seen it in dispensaries, usually combined with THC, which many people like because they don't have to take as much THC. And remember, THC is triggering the cannabinoid receptor and CBG is triggering its receptor. You're getting a multifaceted approach. And most people report with CBG that it helps with anxiety, depression, pain, sleep. It can help with behaviors. I have some kids with autism who have started speaking after we've added CBG, which, I know the receptors, but really what's happening with them is it unlocking something for them, which is great. Remember, these compounds are biologically active.
Right.
They change chemical pathways in your body. And that's what my research shows, is that they change chemical pathways. And sometimes it's for the good, and sometimes you can have an unwanted effect. So we just have to remember that There's no way to guess. Look, I've been doing this a long time. There's no way to guess who's going to respond to what. You just have to try it. Luckily, cannabis is safe and well tolerated,
Yeah.
especially under medical supervision. CBG has been studied for tumors, so GBM. It
Mhm.
shows some real efficacy in combination with CBD. There's studies that show CBG and CBD may be beneficial for leukemia. And remember, these are not in human trials,
Right.
but in animal studies and test tube. There's studies that show that CBD and CBG together, synergy, that's how these plants, these plant compounds, like Mother Nature doesn't give us an apple that contains one compound. There's lots
Right.
of compounds in there, right? And nobody ever said to me, oh, doc, can you take out that one compound in the apple? And like, well, I'm just going to take that. So that's why I'm a whole plant advocate. You want everything in the plant, all the cannabinoids, all the terpenes. I like working with monodominant cannabinoids. So I know, like, if I give somebody a high CBD, how their body responds to that, then I might layer in CBG. But going back to the report I was going to mention, there was a study looking at neuroinflammation, and CBD at the very highest dose helped with neuroinflammation. CBG didn't help with neuroinflammation by itself, but in combination, very potent anti-neuroinflammation. And so I try to use the data from the research to help manage patients. There's still a lot of studies coming out saying, oh, until we know more, you shouldn't use it. But then what do I tell parents whose children are suffering, especially now I've seen what I've seen? I can't undo that. I'm not going to go back to the days where we say, sorry, you shouldn't use that.
Right.
What you should do is you should educate yourself, find a knowledgeable practitioner, and work together to the benefit of the person who's struggling, and including children. And again, I just have to iterate that I am a very neurotic physician. And so if somebody is having a side effect, if somebody is having just any problem with cannabis, the beauty of it is that it's flexible. Instead of twice a day, we can go to once a day. Instead of this combination of compounds, we can switch it to this. You can change the dosing, the timing, all of that. So flexible. And that's botanical medicine.
Could
Yeah, it's
you, Dr.
amazing.
Goldstein, elaborate on what would come up for a child that you would be like, we need to switch, or what would those symptoms be?
Sure. So right now I'm dealing with, I have a little boy in my practice who's 3 years old, who's fighting leukemia. And he just look, he's old enough to, like, be very unhappy with what's coming at him every time he goes into the hospital. So we were just trying to approach this child with some anti-anxiety, better sleep, better appetite. And we started with one compound and it seemed to be working okay. And then the mom said, it's working great during the day, but he's still not sleeping. And so we switched, and the product is giving him anxiety. It's not the right strain. It's not the right amount. And so we are starting now. In fact, I have a call with her right after this to sort out what to try next. Right? Because I would never want to add to his anxiety. You would never why would you take medicine that's harming you or not helping, even for that matter, right? And I see a lot of patients, back when I used to see adult patients, I still have many adults in my practice. I haven't abandoned them and they haven't left me. So we've stuck together, but I'm not taking new adult patients. But I've had patients say, they come in and they're on a medicine, let's say for mood or anxiety, PTSD, and I'll say, is that helping you? Well, I don't know. How long have you been on it? A year. And you don't know if it's helping you in a year. That means it's not helping you.
Right.
Because when somebody comes in and says, oh, that saved my life, it saved me from jumping off a bridge and I don't sob every day, it's clear cut.
Yep.
And I said, well, why don't you go off of that? Oh, well, my doctor says I should continue to take it. If you yourself can't know or don't know if it's helping, I don't understand the idea of medicating somebody with a medicine that is either it's unclear or it's not helping. And to me, that's almost I conflate those two because people, you should feel better if you take a medicine.
Yeah. Yeah, absolutely. And I want to be aware of your time. I'm sure I think we're probably coming up on your time. You're doing good. Okay. What I'm hearing here overall, Dr. Goldstein, is I think it's a powerful statement to make that cannabis medicine is bio-individual. And so what you're able to do, speaking of the flexibility, is really understand how a patient responds and tweak and modify and present kind of a new strategy. And I think it's really powerful because I think coming from a model of standard of care allopathic medicine, we think a medicine does this, right? Even though in that model, medicines also have bio-individual actions, right? But we seem to think that cannabis medicine will act in a singular way on everyone, right? So if I hear a story of how one responds, I might extrapolate and say, I will respond in the same way. You could respond exactly in the same way, and we can predict a lot of that, but we can't predict everything. But it sounds like you have a really big toolbox and to deploy in this. And what is amazing to me to hear is the potential for not only the quality of life benefits, but then also life extension, right? If you were to see a patient have 5 more months on a regular normal pharmaceutical, we would consider that groundbreaking. And for some reason, cannabis medicine and also interventions like the ketogenic diet, which by the way, are also bio-individual and have to be tweaked for the person in the same exact way, modulated in the same exact way, titrated in the same exact way, provide very similar benefits. Yet, from the standard of care model, we have we're looked at as parents when we're asked about this, asked about these strategies. What we confront is an overabundance of caution. And it may just come from our clinicians not knowing anything about it and not wanting to really say anything. But what I'm hearing is that very limited risks, we can strategize to modify as needed. There's a lot of different options. There's a lot of different types of benefit. That quality of life is number one. And out of quality, we may find quantity. In fact, many of us do. And that's a powerful thing in and of itself. Sam was sharing a story earlier on quality of life. I wonder if you'd be willing to share it again, Sam. It was so powerful about Camila. And like, how could you, deny the power of this? Tell us more,
Yeah.
Sam.
Yeah, so for Camila, I used a lot of like I was saying before, we used FICO, and I was doing this by myself because I didn't have that access to, a doctor. I was living in Massachusetts at the time, so it was the way to get it was I had to get something signed by 2 pediatricians in order to get the license. And even the doctors, like there was just this one guy, this one trying to retire pediatrician who was a big advocate in.
Know him, yeah.
Oh, you do? Okay.
Mm.
Yeah, it was him who signed it first, but he didn't know how to help me with dosing and anything like that. He just believed in it, that it could help kids. So in that space, I was kind of just going rogue. I was doing the best I could. I was, giving her fecal right before bed, and it helped her with the bed. And I had this idea that it was helping while she was sleeping. A lot of DIPG, symptoms can be in the sleep of waking up, night terrors and things like that. And I saw it really help with that. But it was when she was going through radiation, literally the first treatment that she had, it was immediate vomiting. And I know there's a part of the brainstem that controls that vomiting. So I think for her, it was just right there. And it was first treatment, she got home and she was vomiting consistently every 30 minutes. And it was really astonishing to me how quickly the symptoms came on. And that was affecting her eating. She didn't want to eat anything. I think it was 2 or 3 days. This was her pattern of throwing up, not eating, and we would still go into treatment. And we got Zofran at first, and they were trying to do steroids. They were trying to say like this would help with inflammation, everything like that. And I was like, I'm not going there because of the side effects of steroids. I knew that very well. And it was one of my contingencies to do radiation was like, then she's not getting steroids. Like that was one of my big goals. And I did have a 1-to-1. I would do tinctures. Mostly at night, I would never do anything during the day because she would get, you know, like some side effects. But an idea that I had
Meaning
was,
impaired.
yeah,
She seemed impaired.
right. So what I started doing was, like, as soon as we got out of the car to go into the hospital for treatment, I would just syringe a 1-to-1, probably like a 0.5 milliliter or something small that I knew wouldn't, you know, like hit her in any type of way during treatment. And as soon as I started doing that, she came home. She was on Zofran at the time, so no throwing up, but she would eat. She started eating. Her energy was up. Like when she was getting that first couple days, she would just want to sleep, lay down, not do anything. But as soon as I did that 1-to-1 for her, it was like she was back to normal. And it was astonishing. And it wasn't anything. It took me like a trial and error kind of thing. Be like, let's try this, because she was miserable. And for as parents, like you said, when the whole family's involved, it's like traumatic for her brother and sister. It's traumatic for us. Like she's vomiting constantly. So this just, it was astonishing. She was eating, you know, like keto ice cream. She was eating again, which was amazing. So I just wish that there was some sort of accessibility or access for parents to know that this is available. And for me, in the same situation I was in, I know a parent would just do the steroids, which to me is that's the one drug with a DIPG diagnosis that everybody wishes that they didn't have to take.
Yeah. Well, and what I'll say, so let me just clarify, 1-to-1 means half CBD, half THC in a 1-to-1 ratio. And when we have that, sometimes the CBD can help dampen down the THC, but not so much when it's in that 1-to-1. The THC is going to definitely have an effect. CBD will as well. And I just think that I mean, and bravo to you for being brave enough to just do it on your own and try to educate yourself. And I'm sorry you didn't have help, but this does show just how kind of benign cannabis is. And the reality is that if your child got high or stoned or impaired or intoxicated, whatever word you want to apply to that, and as long as they're not anxious, it's probably alleviating some of their stress, and it's giving them a little pleasant moment in their life. And I'm not advocating to make children high at all. What I'm saying is that if that's the side effect that you saw, and then we adjust things so they don't have it, it's not like liver damage, okay? It's not irreversible tremors like some of the antipsychotics that are being handed out to children. So let's put it, there appears to be this double standard about cannabis. It has to make everybody better. It can't have any side effects. And oh my gosh, your child got stoned for 3 hours. Well, what are they doing with morphine and opioids?
Dilaudid, I know.
Right, and also benzodiazepines that
Yes.
are used out like crazy for seizure disorders. And again, it goes back to the stigma and the propaganda. And again, under medical supervision and proper dosing, I tell people all the time, and I write about this in my book, it's rule it in or rule it out. You have to see how your little human responds to these compounds. And understand that it's unique. If somebody says, oh, my child is on this, this, and this, that can be helpful, a place to start, but that your child may not respond that way. And one of the things we say in cannabis medicine is we do not treat the diagnosis. We treat the patient, right? Because we can all check off the box of autism or epilepsy or cancer. It's going to be different because chemistry-wise, we are different in the way we respond. And one thing that hasn't been brought up yet on this podcast is the endocannabinoid system. We haven't talked about that. There's a nice piece about that in the first video, in the 3-part videos that I made for MaxLove. And it's important to understand that we have this system in our body called the endocannabinoid system, only discovered in the late 80s, early 90s. And its job is to maintain balance, is to keep you in what we call homeostasis. And when you are ill, it is out of balance. Okay. And the way to get it back into balance is to use cannabis, because we actually make our own inner cannabis compounds. But when we're stressed, getting chemo, have cancer, don't sleep, we don't eat right, we're not exercising, or we just have an illness that causes an imbalance, sometimes you can't get back into balance. And the idea of cannabis is to replace the cannabinoids in the plant look just like what we make in
They're
our
just
body.
exogenous.
Yeah.
Yeah.
They come from an outside source.
Yeah.
And the
Mhm.
concept is like, if you don't make enough insulin, we call you a type 1 diabetic, right? And you
Yeah.
eat a Snickers bar and your sugar's sky
Yep.
high, you have to
Yep.
take a source of insulin from outside to bring it down. The
Yep.
idea is we're augmenting that system by giving it a little plant medicine to help get you back into balance. So when you
Mhm.
say to me, she stopped vomiting, that message in her
Yeah.
brain that's saying alert, poison, radiation, or
Mhm.
vomit
Yeah.
gets back into balance. It's not magic. It's just
Yep.
the brain is now saying, oh, let me shift back into a more homeostatic place.
Mhm.
And it turns off that message of vomiting.
Mhm.
And so, and I just also want to comment, you mentioned she was on Zofran. And people say, oh, it was they may listen to this, oh, it was the
Yeah.
Zofran that
Yeah.
helped. Maybe the Zofran didn't work on its own. There's some evidence that the combination of cannabinoids with some of these antiemetics work really well together.
Mhm.
So why wouldn't you? Why, again, take a medicine that's not working, but if we can make it work better with some cannabis or try cannabis alone, maybe that's all your child needs. But again,
Yeah.
you have options.
Right. And even with the Zofran, like obviously it stops vomiting pretty consistently across kids. But what helped her too with the one-to-one is just like she, even on Zofran, she wouldn't eat. Like she was
There you go.
pretty food adverse. But
Mhm.
that's like one of the bigger ones too that Zofran didn't help was with the appetite and
Right.
the mood and the energy.
Yeah.
Like I saw with her because she was on the ketogenic diet too, when she would eat, how she eats, her energy would go through the roof. Like she had a very high quality of life with how she ate. But if she wasn't eating, she was fatigued. So it also helped
Sure.
with that of like getting her back to that
Just think
state.
about the basics. I want to
Mhm.
sleep and I want to eat and I don't want to be overly anxious. It's just
Mhm.
basic quality of life.
Yeah.
And when you have a DIPG diagnosis, for example, and it is like the time is the most precious resource you have, and how you have experienced that time together is
Mhm.
absolutely everything,
Mhm.
right? If we could package up, Sam, what you did in a drug and deliver that, like between the ketogenic diet and cannabis medicine, it would be the most groundbreaking thing to happen in DIPG in the longest time, right?
Well, that's why I'm here, right? That's what we need
Yep,
to talk about, have these
yep,
conversations to empower parents that it
absolutely.
sadly, it might sound scary because there's not a lot of support, hand holding and that you could get with a standard of care treatment, but just to empower parents that there are these little hanging fruit that you can do to help.
And if I could say something that may be controversial to others, but it's not controversial to me. I'm a
Please
mom.
do.
I have family. I'm a human being on this earth. If I diagnosed a child with a deadly disorder, I would not say, don't use cannabis now, when I know as a physician,
Mm.
but also as a mom and as a family member that we're going to be there at some point where we don't want to be. Why
Mhm.
would I wait to use cannabis medicine
Yeah.
till my
Right,
child is at the end of the road?
Mhm.
And there are
right.
oncologists that are going to say to me, you don't know, and we don't have studies. When you know the prognosis is bad and you tell a child to not use cannabis, I'm sorry. I think that, to me, my professional opinion, and you can think I'm fringe or whatever, but
Mhm.
to me, that is not following the oath of doing no harm.
Yeah.
Because if you would just bother to talk to families who have used cannabis, what you would hear is across the board, it helped my child's quality of life,
Mhm.
not only through treatment, but even at end of life, if that's where they ended up.
Mhm.
And it's important, I think, for oncologists, even if you don't want to be the one to recommend it, remember, nobody's accusing you of being fringe. If you say to a family, maybe you might want to look into cannabis medicine for quality of life issues,
Yeah.
right? Even not just for killing cancer, but just quality of life. That family will look at you and just be so grateful because you've breached the topic, you've talked to them about it. And this goes for anybody, any doctor where somebody's really struggling and they're not finding good results. Pain management,
Mhm.
really psychiatric care. And everybody's wants to live and die by the studies. I'm that way too. I want to see the studies. I want them. They help me practice better medicine. But what I would always counter is, please look at the scientific research, and parents too, if you're concerned, Every single study that has come out using cannabis as an intervention in a medical way, has concluded that cannabis was safe and well tolerated.
Mm-hmm.
I challenge you to find me a study that doesn't say that. Now, yes,
Mhm.
there might be side effects, but overall safe and well tolerated.
Yeah. I mean,
It-
which is huge.
And look, I had a child come to me on a Wednesday who died on a Friday. I cannot help that child.
Mhm.
Right.
And cannabis needs time. And I just think that if you're thinking about it, you know, go to MaxLove, get your information.
Yeah.
Yep.
And then there's resources for you to find a practitioner and get started.
That's a really great point,
Yeah.
because I think that's something we see with even keto too. Like our support with ketogenic diets is like, because it can be so not supported in standard of oncology, that parents do, and this is not the right phrase, but put it off because
Mhm.
that's what they're supported by,
It's
like,
it's a Hail Mary
Yeah,
usually, right?
right.
Mhm.
And that's
The
Yeah.
same thing
what,
with cannabis. They've
Yeah.
been treated exactly the
Yep.
same way
Yep.
in the allopathic model,
Yeah.
right? Because I
Mhm.
had
Right.
patients who came to me who's, have 20-year-old children with seizures
Yeah.
who were looked at keto when their kid was 4 years old, and they were told by
Mhm.
doctors, you're crazy. And they would have to
Yeah.
fly across the country to see some specialist who supported
Mhm.
that, but they didn't get any support. And sure enough, it helped their child. And so, now we know better. We know keto can be
Yeah.
very beneficial. We know certain other kinds of diets can be very
Mhm.
Yep.
beneficial
Yep.
as well. But at the same time, I hate to use the term gaslighting, but there's a fair amount of gaslighting going on with cannabis. And I
Yes.
just want to
Yes.
say that if you broach the subject with your doctor, one of the best ways to broach it is just to say, what do you think about cannabis medicine? So that you
Mhm.
can kind of feel it out.
Yeah.
And if there's an absolute hardcore no, then I'm going to just say one thing. They don't have experience. They don't know. Because after what I've seen over the past 16 years, I cannot deny what I've seen. I'm not claiming everybody does well, and I'm not claiming everybody
Right.
is a perfect candidate for cannabis. But as an option on the table for a struggling child, no question, there needs to be support for that,
Mhm.
but also support in, hey, find somebody to work with, use tested medicine, certain criteria,
Right.
right?
There's
And
a
just
checklist.
yeah, and
Yeah.
education is so important.
Education. Yeah, that's why
We're
I wrote
so
the book.
thankful, like
Yep.
your coursework. Like I think it's going to help so many parents. Like if
Yeah.
they are getting, that wall,
Yeah.
that door shut in their face, it's like
Mhm.
at the least you can do is educate yourself,
Yep.
because everything you've done in your course with Max Love, everything you speak on is science based. It's not
Yep.
anything that's
Yep.
and
Take the course, read the book,
Mhm.
And I
right?
just want to share my friend, Dr. Joe Goldstich,
Yeah.
who is a retired doctor, but he wrote this book, The Cannabis Cancer Connection. It's available online. It's a great book. It summarizes a lot. It goes into detail about the studies. It's written in a conversational style so that
Right.
everybody can understand it. I don't get any money
Right.
for promoting his book, but it's a really nice book to at least explain to you, rather than having to, again, search
Yeah.
all over.
Mhm.
The course that I gave MaxLove is detailed enough to at least get your information so you know about all the things that we just talked about. And this book supports that as well.
We have that book and your book in the resources, and will be in the show notes here. And I think this is just a perfect way to tie it all up. And when you talk to your clinicians, because it really is best to float it out and ask. What we found is when you talk about quality of life, the red flag goes down.
Mm.
When you talk about disease killing, even though Dr. Goldstein, we've got all of this promising research, even though we know it is just like the ketogenic diet in that way. When you start talking about disease killing, that red flag goes way, way up for
I mean, with the clinician.
with the clinician.
Yeah.
And so to help de-escalate, when you talk about quality of life, every clinician wants better quality of life for their
Mhm.
patients. Every single one. You're right. People sign up for this to help people. So the vast majority are going to be interested in helping you with that. There's one hospital in Southern California, for example, that can't refer patients to you directly, Dr. Goldstein, but they can through us, and they've started to do that. And so we're starting to see progress. You have a new business, which is incredible. You're going to be teaching clinicians and providers how to utilize and support patients with cannabis medicine, which is absolutely incredible. So bigger change is coming, and you are, for us, like Sam was saying, if you Google cannabis medicine for kids, you are the resource. And I just love that you are expanding access to you in so many different ways. And so thank you for showing up for us over all of these years, supporting families like ours, supporting our community. You're just a godsend, and we're just so grateful for you.
Well, thank you so much. And thank you so much for the opportunity to talk about my experience, because I really feel like anybody who comes to me and says cannabis medicine it's a hoax, it's this, it's that, they just haven't seen what I've seen.
Yeah.
And they haven't experienced, and good for them that they haven't had a family member who's been sick, that they've had to seek out this. And the way I look at it, though, is that it's just another tool in the toolbox. It has to be available for patients to use, and it can make all the difference for a child who's struggling. It's just, to me, we can no longer in 2024 say no to cannabis medicine.
Drop the mic with that. That's it. Thank you so much, Dr. Goldstein. Thank you for spending all of this time with us. And we look forward to keeping this conversation going with you over the years. We'd love to be able to check in periodically. We have so many more questions to ask, and we know our community will be bringing a lot of questions forward too. And then there'll be updates to research. So we'd love to make this a series. This won't be the final conversation.
Just reach out anytime. Happy to help.